Who let the dogs out?
Who let the dogs out? Who let the dogs out?
It's time for Pet Files Ask the Vet, underwritten by the Millerton Veterinary Practice. Traditional small animal medicine and surgery, chiropractic, laser therapy, acupuncture, and Chinese herbal medicine. 518-789-3440. MillertonVet.com. With us today, Dr. Carolyn Cannon, owner and chief vet at the Millerton Veterinary Practice. Hello, Dr. Cannon.
Hello. Good morning.
Hello, 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 hello. Hello, hello. And Marin in Hudson says, Mindy and Bouncer, my sibling cats, have sensitive tummies. They throw up after eating every now and then, and have since they were kittens. Lately, Bouncer is doing it more often, though, about once every 2 weeks. He seems 100% fine in every other way, and he doesn't seem bothered by it. How worried should I be?
It isn't normal for cats to vomit on a regular basis. So cats will sometimes get into something and vomit, or they'll go chew on a houseplant and vomit, or chew on some grass and vomit. But it isn't normal for them to do it on a regular basis. So it tends to be. This is a pretty common pattern, though, is that you'll see a cat who vomits once a month, and then every 2 weeks, and then every week, and then it's more than that. So it typically is, with a young cat, it usually has to do with diet. So playing with the diet a little bit in a systematic way is what I would start with. And so there's no diet information in this question. Occasionally, a cat will overeat and vomit, but I think that is thought to be the case too much of the time. If that's the case, you have to feed smaller amounts more frequently. But it more commonly, in my experiences, cats on dry food probably have become sensitized over time, or were as kittens to some ingredient in the food, and or they have a poor digestive capacity, and that can be diet related as well. So doing a diet change really to a more species appropriate diet. If they're on dry, try giving them canned food, very high meat, low carbohydrate diet, and see if that makes a difference. That would be the first place I'd start. Is to let go too of the things like treats and greenies and all of that stuff for a couple of months while you're doing a trial. You can also go from there. It's just sometimes as simple as that. You can go from there, though, to limited ingredients diets. Have a conversation with your veterinarian about that. Doing true diet trials to see what your kitty might be having a problem with and causing the vomiting.
And this might be a good time just because it's always the basics. A long time ago, you referred certain people to about cats and dry food, and how that probably, I'm sure that more people serve their cats dry food than we.
Well, we do. They do because it's convenient.
Right.
It's convenient, and there's this idea that came probably from veterinarians years ago that it was better for their teeth, which we know now is not the case. It intuitively, you'd think that crunching something in the back of the mouth would help with the tartar, and crunching something really hard and crunchy like those greenies treats does help. But dry food in general is not as good for your cat as canned food. In my opinion, they don't stay as well hydrated, and I think that you can get information about that on it was catinfo.org. They still have, I believe that website's still up, and it's talking about introducing raw food to your cat, but it gives you lots of good information just about how cats evolved as obligate carnivores and how they need to have meat as their protein source and very low carb diet. And that'll help with digestion.
And
usually.
And that's and what do you say to the my cat will just drink water. My cat drinks a lot of water. I feed it dry food and it drinks a lot of water.
Yeah, you're right. Most people do say that when their cats are eating dry food. They say, "Oh, but he drinks water all the time." Well, he's not drinking enough to rehydrate the dry food and to keep him hydrated. We know that because cats who are on dry food tend to have very high specific gravity or very concentrated urine compared to cats who are on only canned food. So, it's been a learning experience in veterinary medicine, and we try to pass that on to people because we have, compared to dogs, we have historically had a very high rate of kidney disease in cats as they age. And we have to ask ourselves, why is that? Have we kept them, have we taxed the kidneys with borderline dehydration throughout their lives? And so a little bit of canned food dry food in a young cat, okay, but as they get older, so you don't want to start your cat with dry food because then they like those carbohydrates and they don't want to go to the canned food that might be lower in carbs. So that's something to think about with young cats.
Thank you, and I led you there, and I'm sorry, but Maren, again, when you get right down to it, it's like the little things that can help you make a decision about. It's like, okay, so would I check diet? Can sometimes be useful, and as you pointed out in that question, there's nothing about the diet which just suggests that isn't at the top of the, isn't the first thing.
Right, and of course, which I skipped right over, if these kitties go outdoors or they hunt in the house, then of course checking a stool sample for parasites, maybe even just deworming, so that you don't go through all this trouble of diet changing when you've got some roundworms going on there. So that would be the first thing to do.
All right. And staying on the topic of felines, just making sure that they get their due, Gerald in Kingston. Our cat was recently diagnosed with arthritis, and our vet wants to put her on prednisone. My ex-wife was on prednisone for years, and while it did keep her colitis more or less under control, it wreaked havoc on her health in all kinds of ancillary ways. On many levels, she still wishes she'd sought alternative treatment. Our cat's only 6.5, and I'm concerned that prednisone will create more ongoing problems than arthritis. Are there non-traditional options we could explore?
There are many options, and arthritis is not unheard of in a 6.5-year-old cat, but it is somewhat unusual unless there's been some sort of traumatic injury or there's been a deformed limb of some kind or back injury. So, you could be, if you're definitely dealing with a big joint or X-ray evidence of arthritis, then, then number one thing that you want to do is make sure your cat's not overweight. So weight loss is imperative, especially in such a young cat. Got to take the weight off, keep them slim, keep that joint moving. So you want to encourage movement. There are many things that can be done. The same things that we can do with dogs, pretty much we can do with cats. It's just that how do you do it with cats, right? So how do you give them other kinds of medications? How do you give them herbal formulas? It's not an easy fix. Prednisone can be given transdermally. You can even get it to put on the ear, the inside of the ear, and it'll absorb that way. I'm not condoning it at all, except perhaps on a cat at the end stages of life if they absolutely need something to reduce inflammation. But it could be possible that your veterinarian is talking about a short course of prednisone in a swollen joint that might help to reduce this acute inflammation and then keep it under control with something else. So there are drugs such as gabapentin, which is, better for nerve pain than joint pain, but sometimes can help a lot with cats. It has very few side effects. There's laser therapy, acupuncture, chiropractic.
So cats can have all of those things.
Absolutely, and Dosiquin. So Dosiquin Advanced, if you can get it into the cat. So this is always the problem: is
can't some of that stuff be made treaty? Like Dosiquin, for example. I always joke about this. This is now the third time I must be fixated. But once they added the eggshell, even my picky dog, Q the Phoenix, who just basically has this reflex where it rolls, like he tastes whatever it is, and his tongue spits it out, likes it. So
Right. Well, you can get, there are many cats who will eat the Dosiquin. It comes in a capsule for cats, and it's fish and chicken flavored. And you just dump it on the food or mix it in with the food. So many cats will eat it, but I would say probably there's at least 25 to 30% of cats who won't touch their food if the Dosiquin's on it. Again, anything like that you want to try adding to food, you have to introduce it very, very slowly.
Yes,
a tiny sprinkle in a quarter can of food to start with, and you introduce it over a period of 3 weeks, because cats do not like their routines interrupted.
No, they're very clear about that, in fact.
Yes.
One thing around this, though, is when you do give, because we have had cats, as a matter of fact, the current station cats, AM and FM, who are under care, I was shocked, but they were very happy to eat herbals. I mean, they think nothing of it.
Yeah, sometimes they will. It depends on the cat.
And it's not that they're exactly svelte, so,
Or you can put, a quarter of a tablet of a formula in a pill pocket, too. I have that are doing that. So,
we'll do that,
yeah, alternative medicine, absolutely, for kitties. It depends on the personality of the cat. Depends on whether they will eat what you want them to eat. And, again, going on a low inflammation diet, maybe fish oil added to the food as well. But you want to be pretty sure that you're barking up the right tree, as my doodle would say, because it is somewhat unusual to have arthritis that needs treating with prednisone in a 6.5-year-old. So maybe more to that whole situation than I can glean here. But you're right. The
overall,
the
for
statement
years,
of long-term prednisone is not a great thing.
Right.
Not a great answer.
And again, I would just emphasize something that you said at the beginning. Find out whether this is just a temporary. It just says our vet wants to put her on prednisone, right, for like a week.
Yeah,
because that is not clear.
Is it a muscular thing, or is it actually nerve pain coming from the neck? Because you can have a lameness in a front leg if you have cervical disc problem in the neck. So lots of ifs. I'm assuming that that there is definite evidence of arthritis, but it's something to question.
All right. Rivka in Pittsfield, because my dog has Cushing's, he gets a lot of UTIs. Do you have advice about preventative measures? He's a Dalmatian mix, about 3 years old.
Wow, so it's really unusual to see Cushing's disease in a mixed breed dog at 3 years old. 3 years old, I don't think I've ever seen Cushing's disease, definitive Cushing's disease in a dog under 8 years of age. And even that, usually we see it in really aged dogs. It's caused by a benign growth on the pituitary gland in the brain, or a growth on the adrenal glands. And so, it's pretty unusual to see actual Cushing's disease. So here again we go with, let's make sure that we're treating the right thing. Certainly if you control, if you have Cushing's disease, which means that the adrenal glands are producing too much cortisone. And you can imagine too much cortisone, if we give it, can cause immunosuppression. And so then you can end up with skin infections, and urinary tract infections are the most common things. And so if the adrenal glands are producing too much, you get an immunocompromise. So if you can control the amount of cortisone that is excreted, which means treating the Cushing's disease, you should be able to get a much better handle on the urinary tract infections. So I think that, sometimes it looks like Cushing's, and it may not necessarily be. But if it truly is, and if you're not sure, I usually send people to the specialist. If I have one of those weird cases, even in a 13-year-old dog, and it looks like Cushing's, but I treat it, and their thirst, which is the hallmark, doesn't decrease, then I say, okay, I'm going to send this dog to a specialist to see if we truly have this issue. And so that's a good place to start. Now, you want to know if you've got a male dog, then you want to make sure the prostate gland is fine. Is this a neutered male or an intact male? Because you may be having an actual infection from the prostate gland, although, again, really unusual in a 3-year-old dog. There may be something going on in the bladder that's predisposing to urinary tract infections as well. If you're getting repeated E. coli infections, cranberry can help. It helps to, there's an ingredient in it that helps to reduce the adherence of E. coli bacteria to the bladder wall. So all of those things are thoughts, excuse me.
And what kind of specialist?
Internal medicine specialist.
Okay.
Yeah, so you want to know, number one, that you're treating Cushing's for sure in a 3-year-old dog. Pretty weird. And if it's truly Cushing's, is the Cushing's controlled with the medication? And if it is, then why are we still getting UTIs? And there are, of course, you can go to a herbal therapist. There are herbs that can help, if you're addressing the underlying cause. So nothing's going to help until we address the underlying cause. We've got to figure out what that is.
And there are enough, not inconsistencies, contradictions. There's enough weird in the question to make it worthwhile to go to the specialist or get a referral from the vet.
Right, start at square one.
Right.
So usually, if everything's been done, I would have expected that would have been part of the question. But I think that we need to do a little bit more looking as to what is causing these infections. Are there truly infections? Sometimes you get bacteriuria. You get bacteria in the urine with no symptoms, and that is not a treatable disease. So all of those questions come to mind, and it makes the answer more complicated. But that's where I would start.
Very good. All right, Carolyn Cannon. So I'm seeing multiple sources that say one of the major causes of pancreatitis in dogs is eating table scraps. But that throws me off because my trainer has been telling me to use high-value treats to train my pup. For example, chunks of meat. Is there really anything so bad about giving Hudson pieces of turkey or cheese? I guess I'm asking you to define table scraps. It seems like a vague designation.
So oftentimes pancreatitis, when it's diagnosed, is not acute pancreatitis can be brought on, yes, by a very high-fat meal. If your dog's not used to eating fat, runs over to the restaurant next door and gets into the garbage and eats a cup of the rendered fat, then you're probably going to end up with an acute pancreatitis. Most of the pancreatitis that I see is more chronic and idiopathic, meaning nobody knows why the dog got pancreatitis, and they never got into the garbage and ate the chicken carcass with all the skin. That's your typical presentation of pancreatitis, and that's an acute cause and a little bit easier to treat, actually. So what I can say is that, everything in moderation, giving chunks of meat to your dog as training treats is not going to typically cause pancreatitis, especially if they're used to having fat in their diet. So if you've got a young dog, presumably with the training, it's a young dog, you get them accustomed to fat. I mean, a lot of young dogs have those marrow bones that are full of marrow, and they eat half the thing or the whole thing in a day, and it doesn't bother them at all. It doesn't even give them diarrhea. Yeah, so you take it slowly. You wouldn't want to do a pound of cheese in a day. Number one, you're going to end up with a dog with diarrhea, most likely. So
let's talk about what table scraps would be, because one of the things that I would be curious about, but you're the veterinarian, I have a different business, is the multiple sources. I'd be real scared of those. So, in other words, there's no what exactly is saying that one of the major causes of pancreatitis is table scraps. So, forgetting that for a second.
Table scraps. Yeah, I can't say that that's true. I think that people have been giving their dogs the meat off of the ham for years.
Since the beginning
you wouldn't want to do the whole ham in one day.
But
I think that my husband would be likely to do that if I weren't there to say, no, let's do this in moderation and give, a couple of tablespoons of the fat off of your meat. A lot of people don't even buy fatty meat anymore, and
Which is sad.
Don't use it.
But the point is, what are safe? I don't know. I mean, used to be back in the 1300s where you just put the leftover haunch down and the dogs they all devoured it. That was fine without devouring each other. But now that we're far more evolved, what's the you can give them a little piece of chicken. You can give them.
You wouldn't want to give them the cooked bone. I would advise against any kind of cooked bone.
You don't want to give them pasta.
You can give them the absolutely. Take chicken breast and chop it up and use that for training treats.
Yeah.
If we're talking table scraps per se, you want to be careful with garlic and onions. And no grapes or raisins, and anything else is okay.
What about pasta? I would skip.
Pasta's okay too. Pasta,
really?
So everything in moderation. You're talking about when I think table scraps, at least at my house.
There are scraps.
You're talking about not
bowls.
a lot of food. A tablespoon of food that we're not saving for later. So that's okay. But it really is the fat content that you're going to be concerned about. Is taking a 10-year-old dog who's had GI issues anyway, perhaps, and giving them either on a daily basis, all of a sudden you're giving them way too much fat. You may incite pancreatitis. Or the dog who you just decided, they got into the ham, and they got the ham off the table, the two dogs ate the ham, and oh my gosh, they both have pancreatitis. So it's that kind of thing that I have seen.
All right. Aaron in New Paltz, a couple months ago, I started dating a really nice guy with a really cute and really old puggle called Bump. Bump is a sweetheart, but he has a super weird habit of obsessively, randomly licking the carpet for hours on end. Whatever room he's in, once he starts licking the carpet, he just doesn't stop. When I asked my boyfriend, he said Bump's been doing it for a couple of years, and it doesn't seem to hurt him. But to me, it just seems like, isn't there probably a reason for it?
That's an adorable name. Puggles are really cute dogs. So this can be, dogs will lick the carpet obsessively like that. Sometimes when they have discomfort in the esophagus or the stomach. So if there are no signs of that, so if you're never getting the burping, the gurgly tummy, does he always do it right after he eats or an hour after he eats? If that's not the case, it's probably more like a compulsive behavior. I would be a little concerned about all the fibers that he might be getting off the carpet if he's licking it constantly or licking for a half an hour kind of thing, and would try to do something to discourage that behavior. If the whole house is carpeted, that can be really difficult. So first thing you do is you look for a medical problem. If there's no sign of a medical problem, then it is some sort of compulsive issue. And it's hard with older dogs, to distract their attention. But if he's only doing it at certain times of day, you can use a crate and put low-fat or non-fat yogurt in a Kong and have him be busy with that for a little while. And sometimes it'll just be enough to distract his attention. If there are other behaviors that appear to be more compulsive, then sometimes you have to deal with that with medication. But, increasing the dog's activity level and brain activity in an older dog is always helpful with so many things. It brings more blood supply to the brain and helps them with these strange behaviors that they may have.
Thank you very much, Dr. Cannon.
Thank you for having me.
This has been Pet Files Ask the Vet, underwritten by the Millerton Veterinary Practice, 518-789-3440.
Who let the dogs out? Who let the dogs out?